Alright, so I'm Bailey Smith and I'm going to be performing the skill Venipuncture and starting an IV. I would walk in, introduce myself, close the door, and wash my hands. I would explain the procedure to the patient, just ask them if they've ever had a IV started before, and if they did, how well they handled it. Explain to why we're starting the IV, and what we're going to be doing with it, and look their arm over and just let them know where I'm going to be putting it in. So I'm going to go ahead and I'm going to get my equipment ready. So I washed my hands, I've got everything ready, got my saline flush, and normally I would have tubing that would connect to the catheter. Got my tourniquet, tape, and 20 gauge catheter, and my transparent dressing. So today we're using a banana as my patient. And I'm going to go ahead, before I put my gloves on, I'm going to go ahead and get some tape ready. And so, just so that way it's easier to handle it without the gloves. So rip off a piece, and then I'm going to split it in half. Put that off to the side for later. Okay, I'm going to go ahead and put on my gloves. And I just want to make sure throughout this procedure I'm just maintaining asepsis. And before I actually start the IV, I'm going to want to look at the purpose of the venipuncture and determine where I'm going to put it in, the type of catheter, so like the gauge and the length, and the equipment that I'm going to need. Let me take off my rings. As you can see, I've used these gloves a lot, and baby powder is no longer in them. Ran out of regular gloves. Alright, so now I've got my gloves on, and then I'm just going to inspect the extremity. I'm going to see where I'm going to put my vein at, so I'm just going to look around. I'm going to want to feel around on there. So normally you can either put it, there's a lot of different places you can put the vein. There's subclavian, radial, cubital, mid-cubital, and the cephalic. A lot of people use the forearm, but most common is the top of the hand, because that's where you can see the veins the best. So I'm going to feel around, and I'm deciding I'm going to do the top of the hand. So I found where I might want to put my vein. So I'm just going, or put my catheter. So I'm going to go ahead and wipe off my area, and I'm going to start in the middle, work my way outward in a 2-inch border. Okay. And now that I've done that, I'm just going to allow the solution to dry. I don't want to blow on it or anything. And I want to make sure my limb is in dependent position, so that way that blood flow gets going to the bottom. And before I would do this, I would want to make sure I would be flushing my short tubing, priming it, just so that way there's no air bubbles. And normally there would be like a tubing connected to this, and you would just put it in. Oops. And it would flush or prime. So, and then I would leave it connected like that until I actually apply that tubing to that catheter. Alright, so now I'm going to go ahead and dilate my vein by applying my tourniquet. tie it tight and take it down through, make a little loop and leave it like that, so that way it's easy to pull off once we're done. And then also, before, you want to make sure, ask the patient if it's too tight for them or too loose. So after I've done that, I want to also I want to have a patient clench their fist, and to get that blood pumping and pulling down, so that way I can identify the vein better. I can also use heat packs, or, and we said opening and closing the fist. So after that, I'm just going to identify my vein that I'm deciding to use. So I'm going to be putting it right in this vein right here. I'm going to take my syringe out, and I'm going to pull that skin taut because some of the veins can move around from side to side, so by pulling the skin taut, it prevents them from moving side to side, and you're also preventing from the catheter from going outside of the vein or to the side of the vein instead of in the vein. So after I've pulled that skin taut, I'm then going to insert my needle at a 15 to 25 degree angle. Normally there would be like a retracting piece on the end of this, so that way the needle would just retract back. And I'm just going to make sure that this pink cap is a little bit loose and just twist it a little bit. So then I'm going to go ahead and I'm going to insert that. Okay, and once I've gotten so far, I'm just going to insert it a little bit more. Here, bring it closer. And then I'm going to take off my needle part and hold this down. And I'm going to just insert it, and it's going to go in the rest of the way. And I make sure I don't want to touch that catheter part. And then I'm just going to hold it down, so that way no blood is going everywhere from outside the catheter, because blood will go through. And how I would know to identify that it's in the vein is that catheter part, I would see blood going through that. So then right now I would be attaching my primed short tubing, and I would then apply my tape. So I'm going to just secure that catheter in place. And I would also I need to take off my tourniquet. So I took off the tourniquet, and then I'm just going to use my other piece of tape. Oops. And I got a little bit, but I would go underneath of that then catheter and crisscross to secure it even more. And then last, we're going to use our Tegaderm. And apply that right across to protect that catheter and the IV site from getting anything in it, and also it's clear, so that way we can look at the skin and see if we see any infiltration or any inflammation or anything. So just want to make sure that when you're taking that off, that all those sides are pushed down. And that there's no bubbles or anything. And then also, while you would be putting that, and then I would be flushing my line. And then while I'm flushing my line, I'm going to want to know if I see any puffing of the veins, or if the patient complains of any burning along that vein, because that could mean that saline is actually not going into the vein, it's going around the skin. And then I would clean I would document using correct format, the date and time, state how many attempts it took, state the needle size and the type, the site location, the states the intravenous solution that's infusing and the rate, or if there's a PRN adapter with a flush, and state the patient's tolerance towards the procedure.